Welcome to Early Intervention Matters, the podcast that helps parents, teachers, and health professionals understand the diagnosis, treatment, care, and support of children with autism, ADHD, Tourette's, and other neurodevelopmental challenges. Your host, Dr. Inyang Takon, is a consultant neurodevelopment paediatrician, and she will provide insight through interviews, answering questions, and breaking down complicated topics. By sharing stories from parents and professionals in the field, we hope to make sense of what can be an overwhelming topic. Early intervention is crucial with children with developmental difficulties. Yes, early intervention matters. And now, here's your host, Dr. Inyang Takon.
Today I'm being interviewed by Eme Bassey, who is going to be asking me questions about our podcast series. So relax and enjoy this series. Thank you.
Dr. Inyang Takon, welcome to the show.
Thank you very much. Thank you, Eme.
Okay, so what I want to do today is I want to ask you a few questions. You have a podcast coming up, the Early Intervention Matters podcast, but it's a podcast that's going to be launched very soon. And I want you to just give us the lowdown so that we can get to hear your story and you tell us who the podcast is for. So could you just say hello and tell us who you are?
So hello, everyone. Again, Dr. Inyang Takon. I'm a pediatrician, a consultant pediatrician who's practicing in the UK. But I have practiced for many years in Nigeria. I've actually been in the UK now for 21, going on 22 years. And I started my medical degree and also did a postgraduate in Nigeria before coming over to the UK. And the reason why I decided to launch this podcast series was when I trained in Nigeria, it was a different kind of focus that we had. It was more on dealing with what we call acute medicine or acute pediatrics, so treating very sick children who came into hospitals, and we were more trained towards dealing with those crises and making children well. But what struck me as I was ending my career then was that there was another field for children who had difficulties, disabilities, and disorders which I never knew anything about when I was in Nigeria. And when I came over to the UK, that was an area that I got very interested in. And I actually came over to the UK to further my study in that area. And then I discovered that actually we had lots of children needing similar services all over the world. And I felt then that I really needed to, get more in and learn this. But saying that, being in the UK as well, having gone through this practice and had this experience, I found out that there was still a lot that could be done. One, we were diagnosing children late because people were presenting later. Families were not aware of when their children had difficulties. And also people didn't know what signs to expect or what to make of what concerns the child had. And as a result, when children are diagnosed later, there's more difficulty in actually getting help in early. And what we do know with these conditions is that early intervention results in better outcomes.
What would you say was like a turning point, something that made you say, oh, I really need to just pay attention to this early intervention, as where the focus of your attention is?
Well, the turning point for me was that I could see children who were picked up early and had the support, and things got better.
What do you mean by picked up?
So children who in the clinics who were identified, so those who were referred early, and we did assessments early and they got their diagnosis early, we could quickly give them the support they needed. And being a pediatrician that follows up children for a long time, I saw the difference it made when children got diagnosed earlier. And had the support and had the interventions and actually became better, as opposed to when they got diagnosed late, and all the problems that they would have, experienced, both for the child and the family, and all the distresses that the child would have had, in school, in the society, and the fact that things were more complex at that time. Um, I then felt that there were so many reasons. One, parents didn't know where to go, didn't know where to seek help from, and didn't know that there was actually things that, there were things that could be done to improve the child's life. And
Yeah.
also, there were also myths, and some people had different, perceptions about coming forth if their child.
So, as a pediatrician, is it that you were hearing the same myths over and over again, or the same questions over and over again?
Yes,
whenever you see your patients or the parents.
Yes, I was hearing very similar problems coming up from parents. So it was quite interesting when you asked parents about some of these concerns when they started. Some parents didn't even know some of those things were concerning. So I was picking this up, that some parents didn't even know that these were early symptoms that they needed to seek help for. And I felt that
You just
there was
remind
a
me
need.
of when my son he used to play with these wheels. He used to play with anything that spins. So anything that spins, so wheels, tires,
Yeah.
pots, lids, and all. Yeah, and he would go to shops and he'll roll the tin cans on the. I thought it was just like something that he likes playing with. I didn't realize that this was a very one of those common signs of things. So things like that. So parents not even
Yes.
realizing, or they
Not
know.
realizing or thinking it was maybe naughty behavior. So a child who went into a noisy place and started having a meltdown and screaming, and everybody looking at the parent and saying, "What's wrong with your child?" The parents would get very distressed without realizing that actually that child was overwhelmed with sensory input, and that could be an early sign of something to seek for. So some parents may think this child is just naughty, so naughty, and everybody else would think they're bad parents. So we kept on hearing a lot of this, which is why we felt that giving parents the tools to make them know when there are concerns and seeking help early is very important.
Yeah. So why do you think now is why is it important now more than ever, what you're doing, or what you're trying to do?
So one of the reasons that has made me really want to do this is that we're getting a lot of referrals, or I'm seeing a lot of children being diagnosed later and later and later. And as you know, I work in the NHS. There's a massive waiting list to see patients. And I've also done some work internationally. So I've kept going back to Nigeria to do some work. And it's even worse there because people don't know. Um, the awareness is not even there. So looking at those factors made me think it's not just something I can solve in the clinic. It can't just be me sitting down and seeing the children who are referred, like one patient at a time. It's not that. It's actually me going out and giving the message out so that people can listen to these messages. It might be for them, it might be for a family member, it might be for a neighbor, but just somebody who can hear this message and say, actually, I think this might be something that we need to look into. We should get help early. So that's the reason why I decided to do this now.
Okay. What you said just reminds me again of as you may or may not know, my listeners, as you may or may not know, I'm the mom of two autistic sons. But what you said just reminds me that when my second son was being diagnosed or tested and being diagnosed, it was easier than the first one because we kind of like could see, in fact, we saw the sign, we could now recognize the signs. because we had gone through it with the first boy. So that bit of knowledge, because when you think about what you're doing and that you're trying to educate people, one mind might say to you, oh, so what if you make the person know more about what the thing is? But sometimes it might just be being able to recognize the signs, to know what kind of help to ask for, that kind of thing, instead of having to learn by trial and error kind of thing. So I do remember it was much easier. We saw this, we actually didn't even want to see the signs, but we saw the signs in the second one that, oh, this is it's looking like he's having the same problems. So when you were going to get the diagnosis, it was almost just a confirmation of what we had already suspected. So yeah, I think having just a bit more knowledge, not as much as you though. So tell us about your qualifications, your plenty school, the plenty school that you went to.
Well, I would say that I had my, foundations in Nigeria, in the University of Nigeria. So after primary and secondary school in Nigeria, I attended University of Ibadan, and the medical school there was University of Ibadan Medical School and University College Hospital, Ibadan. So I finished my medical degree there, did all the housemanship in Ibadan as well, and then did my youth service. Following that, I then did a fellowship. So I did a postgraduate residency in Lagos University Teaching Hospital, where I, from after that, qualified to be a consultant there. But because at the time I'd finished, I really wanted, like I've said to you, I started getting more interested in more learning up more.
So you were already a pediatrician
Yes.
in Nigeria.
I was.
Yeah, okay.
So I'd already qualified as a pediatrician
pediatrician
in Nigeria. So
Okay.
I've got the fellowship of the West African College of Physicians in Nigeria. And then I was so keen on learning more about neurology. As I said to you, getting more training in those subspecialties wasn't really there in Nigeria. And that's what I was really keen on doing. So I was lucky to get a World Bank scholarship to come into the UK when I did, to the University College London, and I did a master's there. And after that, I felt it's been great. I've learned a lot from the masters, but then I wanted to get more practical clinical experience. So I then decided to do more postgraduate training in the UK. And that took me down to Scotland, where I spent several years in Scotland, training in the hospitals there.
So and then training and working as well.
So that's training and working. And then came over to Great Ormond Street Hospital in London, where I did my more neurology training and epilepsy. So that was really great experience for me. And it's following that I got a consultant job in the hospital where I work, where it's been great because I've been doing a lot of work in this area. I've been in my job now for, I keep thinking how old I sound when I say this, but this is going to be my 17th year as a consultant pediatrician at the QE2 hospital where I work. Oh, wow. And I also practice independently. I do private work as well. And in between that, I've done lots of other studies and gotten a few other masters.
So what are the, for those of us lay people, what are the conditions that you come across? What are the conditions that come to you? I know there's epilepsy and there's autism. So what else?
So I see children with what we call a wide range of neurodevelopmental disorders. So neurodevelopmental means anything that affects the brain as a child is growing up, from birth to when the child is growing up. So I see children who've got autism spectrum disorder, attention deficit hyperactivity disorder. I see children with tic disorders and Tourette syndrome. I see children with epilepsy. So I run specialist epilepsy clinics in the hospital and also within the community in special schools. And I also do some neurology as well. So I do clinics with the consultants who come all the way from Cambridge, and we see children with different neurological disorders. And I see children who have other conditions, developmental delay. So any child who's got delay in their development, I will see children with genetic disorders, children with cerebral palsy and any motor disorders. I see them, and I see children, and I've also got expertise in seeing children with fetal alcohol spectrum disorder, which is one of
The one we were just
the,
talking
the,
about,
the
yeah.
areas that I'm really interested in. So I see children with a wide range of conditions, including children with sleep difficulties, for many reasons. So, as part of my work, it's usually down to the basics first and try and understand what has happened with the child. I examine them and then do investigations. And for some children, I see them regularly. And that's the rewarding part for me, because I've got the benefit of being in the life of that child
Okay, so
until
you're
they get to
there.
adulthood, which is usually quite a great thing to see
the
how the child has done throughout.
development.
Yeah.
Okay, back to your podcast. So your early intervention matters. Who would you say this podcast is for?
So, first of all, I would say this podcast is for everybody, because um, it is not just the family that is affected that should learn about this. The aim is for everybody to be educated on what it is and how a child with neurodevelopmental disorder presents, because there might be that one person who would actually see that child and say, I think this is what is happening, even when the families don't know. So we are each other's keeper. And I keep saying it's better for everybody to be educated, not only to signpost the family, but also to understand actually how those children present. This brings me back to a situation that happened when we visited Nigeria, and we wanted to get our Nigerian passports renewed. We went into waiting for, where we went to renew this. This was myself, my husband. That was in Nigeria. Myself, my husband, and my two daughters. And it was very, very busy. It was so busy. And in front of me was a lady who had a son who was very distressed. He was so distressed. And anytime it got to him having his photograph taken, he had a huge scream and meltdown. And the people doing the passport kept telling the woman to go out,
take him away,
and go and calm him down before they bring him back. He was very distressed. He came back 3 times, and the same thing happened. I remember saying to my husband, I think that boy is autistic. And my husband saying, how can you say that? Why can't you just sit down and look at the boy and say, I think he's autistic? And then the next time the mother came in, she said to the cameraman, I don't think he's going to stay. He's autistic, And I just thought this would have been so important for everybody working there to be
realize,
aware. So it's not just the families that are affected, it's everybody, people who come across children every day, and so that they can appreciate what these families are going to, and they would know how to support the parents and the children better.
Okay. I think we have said everything that needs to be said. Thank you so much. So where can we find you online?
So you can find me on www.drtakon.com for my podcast series. And you can also find me on www.school-doctor.com. So School Doctor is a neurodevelopmental online service, which I'm one of the co-founders of. And if you visit that website, you will get a lot of information about what we do and how to access support and diagnostic assessments if you want that. So that's where to find me.
And the Clubhouse people?
And for those on Clubhouse, I host a weekly Friday 8 to 9 p.m. series. It's I host it with other colleagues of mine, some of whom are on School Doctor as well. But it's a very informative session where we have different topics, and it's free for anyone to come in and listen and ask questions. You get lots of experts on the panel, child psychiatrists, pediatricians, speech and language therapists. We've got expert parents, and we've got young ambassadors as well who've done really well and are there to support. So do join us 8 to 9 p.m. if you're on Clubhouse.
On Fridays. All right. Thank you so much, Dr. Takon. And thanks for coming to the show. I hope you do check out her. I am a parent, but then I'm also a concerned citizen as well. So I really hope you check out her podcast. You can find her at drtakon.com or Early Intervention Matters Podcast, which will be on everywhere podcasts can be found, iTunes, Spotify, and so on. And I will see you next week, where we'll be meeting some other interesting people that I think is worth you knowing. Have a wonderful day. Bye.
Thank you so much for joining us. Thank you. And we hope you will visit us at our podcast series. Thank you. As we always say, early intervention leads to better outcome. And early intervention can only be achieved by early diagnosis. So thank you for listening into the series today. I know some of the things we've talked about today would probably have generated some questions or need to seek clarification. So I'm happy to take questions, and I'll invite you to send your questions to eim@drtakon.com. Thank you for listening in.